Well, hello, hello. I would like to take this moment to welcome you to growth season. You guys, we are starting a new series and it's going to be called Grow in Health, where I have multiple episodes covering the topic of health, but from different ways. So today is going to be our first guest. His name is Dr. Harold Landis, DDS. You guys, this gentleman, I'm so excited to be able to have him on the program. And I know that you're going to benefit from listening to him. He is a wealth of knowledge. And you guys, like I said, he is a DDS, so he's a dentist. He's been in practice for over 38 years. So just under 40 years of practice. He's also a fellow of Integrative Medicine. So there is a lot of experience, a lot of knowledge under his belt, but also a lot of practical hands-on working out of that knowledge. So he really knows what he's talking about. This gentleman loves to lend that knowledge to benefit others and to help them to grow in their health. It's an honor to have him here today. So welcome, please welcome you guys, Dr. Harold Landis, DDS. Welcome, Dr. Landis. We're so excited to have you here with the Growth Season community. For those who do not know you, sir, would you mind giving us just a little bit of background, who you are, where you're coming from, your desire, how long you've been practicing, et cetera, et cetera?
Certainly, and thank you for having me, Susan.
Yes, sir.
It's a privilege to be with you today. So I am a general dentist who's been practicing just shy of 40 years.
Wow. Yeah.
So in Silver Spring, Maryland, I graduated the University of Maryland Dental School, 1983. Attended Columbia Union College prior to that as a chemistry major. So since then, I've been on an amazing journey, working towards overall health.
Yeah.
I'm currently a fellow in integrative medicine at the University of Arizona. I did a mini residency in pediatric sleep medicine in 2016, University of Tennessee. I've incorporated all kinds of novel testing and just ways to identify health problems into my practice.
Mm-hmm.
So it's been a journey that, as I look on it, I know has been, God has directed the entire thing.
Wonderful, wonderful. And, you know, I'm going to title this episode, those who are probably clicking on it, watching it, listening to it already know, I'm going to title it Growing in Your Health or Grow in Health. And so, Dr. Landis, some people might not understand the connection between talking to your dentist and having a deeper understanding of your health outside of your mouth. Before we jump into some of the reasons why that's all connected, you said something, and I was wondering if you could explain what it means. You're a fellow in integrative medicine. What is that for the community that might not automatically grab onto those terms?
So integrative medicine is a combination of what we would call holistic or alternative types of medicine, combined with what we often term Western or allopathic medicine.
Mm-hmm.
So we're finding that patients are becoming more and more interested in alternative treatments for anything, really.
Yeah.
And they're right. I mean, we've got it wrong in so many ways in traditional medicine. We're not really healing people. We're more or less covering up the symptoms.
Understood.
And so getting to that basis of becoming whole again, it's a challenge for physicians currently under the insurance mandates. They may spend 4 or 5 minutes with you. If they see you at all, you may see a nurse practitioner or a physician's assistant, and you don't really get to talk about, well, how do I get healthy? The interesting thing about dentistry, we come from everything that we do from a preventative standpoint.
Yeah.
So when was the last time anybody went for a preventative wellness visit with their doctor?
Right.
So it's been very fascinating for me because I have a captive audience for maybe 30 minutes to 90 minutes, depending on the procedure,
Yes.
where I can actually ask questions and actually find out what is really with my patients. Are they healthy? Do they feel healthy? Do they not feel well? And they're often shocked, coming from a dentist to ask these questions. And then when I have answers for them, they're even more shocked. So I'm fortunate to be in a position to actually spend time with people.
Yes.
And that is so critical. And that's one thing we really need to improve in all of our visits with our physicians.
Yes, sir. You and I have had many discussions about health, and I'd like to kind of dig into some of that because I believe that they would be a great benefit to this community. So there is a huge discussion about health right now. There's holistic, allopathic, there's vaccinate, don't vaccinate. There's 1,000 different layers. And then you've got people. And every person is different depending upon the environment, their genes, the things they eat or don't eat. I mean, there's just 1,000 layers to this, Dr. Landis. And I can't help but wonder what you think about the conversation where all of your health starts in your gut.
I absolutely agree with that. I mean, when we start working with anybody who may not feel well, we always start with the gut. Mm-hmm. So many things occur within the gut, and the gut has direct communication with the brain.
Right.
And, just to give an example, most of the serotonin for those who may be anxious or depressed is actually formed in the gut, right? It's not even formed in the brain, yet it can dictate how we feel. So if we have inflammation in the gut, we have inflammation everywhere. All of your nutrients are absorbed in the gut. If you have dysbiosis, and you can have really healthy bad bacteria, but you're not getting any of it. So until we solve gut issues, starting from the mouth all the way down, we're not going to make anybody well.
I want to touch on that. You said starting from the mouth. So Dr. Landis, is it really the gut that's most important, or do we start in the mouth?
Well, we start in the mouth for sure. I mean, that's where digestion occurs. The amylase in saliva is starting to break down your food, but you're absorbing nutrients immediately. So many of the nutrients are absorbed in the what we call the buccal mucosa, the inside of the cheeks or under the tongue. We know that the tongue is a delivery system for medications such as nitroglycerin, but we also find it's very good delivery system for a lot of the people who are deficient in vitamins. Vitamin B12 is much more absorbed and bioavailable if it's sublingual. I'm sorry. I have patients who are deficient in vitamin D, and it's like, wow, I'm taking 5,000 international units a day, and I can't get my blood levels up. And it's like, well, you've got an absorption problem. For those patients, we'll say, try sublingual vitamin D3. And a lot of people don't even know that's available. But then we often will see, well, your levels are terrific now.
Wonderful.
So, it starts in this. If you've got bad bacteria overgrowth or candida, it's going to start right in the mouth, and it's going to affect everything from there on down.
Now, Dr. Landis, am I correct in saying that it can become a systemic fungal infection? Is that correct? And it's very difficult to get rid of. You've got things in the mouth like C. diff, Clostridium difficile. Is that correct? So you've got like C. diff. So all of this stuff, the possibility of these things in our mouth, it can then permeate into the rest of our body. And I know, Dr. Landis, tell me this, what kinds of organs or systems can be affected by oral health? I thought I heard there was a connection to the heart as well, isn't there?
Well, there's connection to the heart as you get bacteria, especially bacteria in periodontal disease, disease of the supportive structure of the tooth.
Mm-hmm.
It's a direct connection to 7 different types of cancers.
Mm.
It's pneumonia, heart disease, stroke. So yeah, by having they have even found periodontal bacteria in the amyloid plaque of Alzheimer's disease.
Interesting.
So yeah, it goes everywhere.
So, Dr. Landis, we're seeing that obviously oral health has a ton to do with the rest of our physical health. Are there things, and I can give you an example if you want me to, just based on our conversations, but are there things besides the teeth and the gums that give you indications for health or for someone's condition, their health status, that you can see as soon as someone leans back and opens their mouth? I remember once you had said something about the scalloping in my tongue.
Well,
or maybe
actually,
like a tongue tie.
If we go back to traditional Chinese medicine, which is more often right than wrong, all traditional Chinese practicing doctors, first thing they will do is they'll read your tongue.
Wow.
So the different areas on the tongue do represent specific organ systems. And by looking for red patches or any type of a change in the salivary glands, we can actually predict what organs may be affected for your disease. So tongue reading, we would say, oh, are you kidding? And it's like, no, it actually works. And I've been able to utilize that in my practice. The scalloping that you're talking about is often associated. Those scallopings are little indentations on the lateral border, the sides of the tongue. Those are caused by your teeth, and your tongue is pushing forward to try to give you a wider airway. And we often will see that in people who have a narrow airway or possible sleep breathing disorder. Yeah. Which leads to the tongue tie that you mentioned.
It's all connected. Are you guys starting to see this?
You know, that's a hot button for me.
I'm grateful for it though, because you've given our family wisdom. And so I just had to hit it, because even if they don't, our community doesn't have a tongue tie, or they're not, dealing with sleep issues, whatever, this is a glimpse behind the curtain to see how it's more than just teeth cleaning, family. There is so much, and we don't want to overwhelm you. So we'll circle back, and we're going to simplify this by the end of the podcast. So do not worry, but bear with us, just learn a little bit and hear the brain behind Dr. Landis here. I'm just really grateful that you're sharing this with us. Please continue.
Yeah, so the tongue tie that we see, often we try to identify at birth, and it will really, if the tongue tie is there, then breastfeeding is going to be very difficult. The baby will be unable to latch. Yep. So baby and mom will be unhappy. And we'll see often the baby will fail to thrive and will start losing too much weight, be very colicky because too much air is coming in because the tongue just can't form a seal. So in the olden days, midwives used to always keep their thumbnail very sharp. And when the baby was born, they would just lift the tongue to see if it was tied, just slice it right then with their thumbnail. But we got probably in the 40s, 50s, 1940s and 50s, we thought that really didn't matter. So we stopped addressing it. And then it came back, and no, this really does matter. So I've seen multiple times, just hundreds of cases, people will bring brand new babies, 10 days old, into my office. We'll identify the tongue tie. And then often we'll have an oral surgeon with a little laser. It can be done with scissors, but it's a little cleaner, a little less bleeding, to just take care of that tongue tie. And we have the baby breastfeed immediately. There's a lot of terrific healing antibodies in the breast milk, and baby doesn't care, and mom and baby are happy, and we see immediate weight gain. So we start that early, and we find out. I'm sorry.
I was going to say, just a little inside look. My son Gideon was born tongue-tied, top and bottom, so lip-tied, tongue-tied, and we had both top and bottom lasered. And so we had been through so much already. It seemed like this impossible task to do after having gone through so much with his birth, to take him in, to leave the house now that I got home, to go in and get it lasered and go get it. But it really is super fast. He kind of cried, yelped for just a hot second, and then we set in to try to breastfeed. Now, our journey is different and it's long pertaining to those things. But for those who are going, what? You laser them out? Yes, and they're okay. And it's so they can feed. And it's like one thing outweighs the other. And yeah, I'm just attesting to the fact that what you're saying is very real, very true, and more common than people think.
It's become increasingly common, and we could get into that a little bit. It's possible that
I would like to jump into some of that, because as we're moving through this, I would inevitably like to move toward this thought that everybody's chemistry is different, and there's such a growing need for personalized health and personalized assistance and supplementation and all of these different things. And will you expand a little bit on where things like the tongue tie and some of that comes from?
Sure. So we have a theory that we may have increased tongue tie by the activation or the more prevalence in a mutation of a gene called the MTHFR. And that has to do with folate. So our body needs folate for so many different processes, but we replaced folate with folic acid. Mm-hmm. And for people who have specific gene modifications, it's possible that the prenatal folic acid could think of what folic acid is supposed to do. It's supposed to correct midline defects.
So midline family is right down the center here.
So we see less spina bifida, we see left cleft palate and cleft lip, right? You hardly see that at all anymore. Mm-hmm. So folic acid's done a really good job on that. But for some people, it may bolster midline areas, and that would be where the frenum is. So the frenum is that little piece of tissue that's underneath the tongue that creates the tongue tie, and on the upper lip, right? Mm-hmm.
And not here.
And so it's more prevalent now than it used to be. I've seen a change in the 40 years that I've been seeing kids. I'm seeing the tongue tie a lot more often. Mm-hmm. And it can be hard to identify. Tongue tie has 4 stages. And in the 4th stage, you can't even see it.
Interesting.
You raise the child's tongue and it's like, well, it's buried in the muscle and it's got to be dissected out to actually correct that. Mm-hmm. So there's a lot of misinformation from pediatricians, even pedodontists, that are not educated mm-hmm. to know how to look to see, is that tongue really tied? Well, if it's tied, it can't go up against the roof of the mouth. So baby cannot suckle properly. Mm-hmm. And it will be unable to expand the palate.
Tell me why that's so important. So you're saying that the tongue cannot properly sit as it's supposed to into the roof of the mouth, and the pressure from the tongue actually helps to adjust an appropriate jawline. Is that correct?
Yes, that is correct.
Why is that important, Dr. Landis?
Well, that determines how open your airway is. So if the tongue isn't expanding the palate will grow up and back, which is superior and posterior. And your palate will actually start to impinge on the sinus areas, and it will decrease the opening for the nasal passages. So we see this with crowding. If you asked your audience how many of their children or children they know are in palatal expanders, and it's like almost all of them.
Yeah.
As we're seeing this crowding You rarely see excessive space between teeth anymore. You see them doubled up on one another. And that's because the pressure from the cheeks are winning, pushing things in, and the tongue is not able to counter that force and push things out. So where this really becomes important is we have found this will result in mouth breathing instead of nasal breathing. And when the child will shut their mouth while they're sleeping, they are not getting enough air, and they will be very restless sleepers. We'll see a lot of behavioral problems, getting out of bed a lot, separation anxiety, inability to really potty train.
How is the potty training connected?
Well, when we sleep at night, we produce a hormone, and this is true of adults as well. It tells the kidneys it's nighttime, quit working so hard, right? We don't want to get up all the time. So just slow down. And if you have interrupted sleep, that hormone isn't produced. And so we think it's day, and the kidneys are doing their filtration job very well. And you're up a lot, right?
I see what you're saying now.
They can't get out of bed that often.
Yeah.
Well, where this really goes, which gets really interesting, is that Europe is quite a bit ahead of the United States in this. There's literature to suggest that 80, which is a huge number, 80% of ADHD is created by sleep breathing disorder.
Interesting, because of the hormone regulation at night.
And for just getting that air, and they're not getting.
Oh.
How does a tired child act? They're all over the place.
Yes.
They do not crash. They are all over the place. They cannot focus. And so that's a huge amount. So in some countries in Europe, you cannot write for a stimulant such as Ritalin without showing the child has had a sleep study.
Interesting.
Right.
I really appreciate the root cause approach that some physicians and types of medicine will have. And I'm not against allopathic medicine, and there's none of it. I believe that all of it is good and can be applied in proper ways. But I think that we should definitely know more of this stuff, Dr. Landis. Thank you so much for telling us. I know that there's parents listening going, oh my goodness. So family, if you've gone past this, or you feel like it's too late or you didn't know this, and I know sometimes as a mom, my heart goes, oh no, I didn't do it, quote unquote, right. None of this is meant to cast any negativity over what we know or don't know as of yet. It's simply enabling us and helping us to grab a hold of good information now, and what will we do with it, right?
Absolutely.
Yeah. So Dr. Landis, I really love the holistic approach that you take for dentistry. And of course, you're always, working within the ADA guidelines, and you're always, taking care of that. It's something I appreciate about you as well. Since we have talked about some of the genetic possibilities, which it's kind of a hot button lately, the genetics, these different types of tests that you can take. There's a lot of different brands. Is it safe to just randomly, is it wise or ill-advised to randomly take these DNA tests and have all of our information out there? Is there something better that we could choose?
Well, the biggest problem with looking at genes and mutations is that when we see mutations, we immediately associate that with, I've got a disease. And it's not at all true.
No.
So I'll give you an example. For myself, on my genome, I could not have a worse genome for peanut allergy.
Oh, wow.
It doesn't exist. I am mutated on every possible gene or protein that indicates peanut allergy, yet I eat peanuts every day.
So having the mutation doesn't necessarily mean that it's expressed.
That's Correct. So it's a light switch. Just because it sits there doesn't mean it's turned on.
Mm-hmm.
So the problem is we get this information. It's like, oh my, I've got all these mutations. I've got all these diseases. Well, no, you don't. But you are at risk if they're turned on. That goes for, everything in your body. I mean, we're looking at 20,000 genes with, up to 250,000 possible, what we call SNPs or polymorphisms. It's like you can really get anxious and worry by doing the genetics and saying, I have this. So it's a tool. It's not diagnostic. So
I think that's very nice for you to say. Thank you. It's a tool. It is not a diagnosis. Okay.
That's correct.
Thank you for that. Dr. Landis, is there a HIPAA protected DNA test?
Kind of. We have the ability to run genetic testing where it is HIPAA protected. Having said that, anything that's done online, somebody can get to.
Right. So it's hackable possibly if you're a brainiac, but in general, the intention is that the information is to remain private. Because I know that some of these groups and companies and businesses, they sell your information.
No, that is correct. And I don't know, the most common ones that you would think of sell your information.
Yeah.
So unless it's run really through a medical, you're less likely to fall under that HIPAA umbrella. But having said that, I have parents who worry and they want to know some things on their children. Mm-hmm. And it's like, well, why is HIPAA, I'm assuming everybody knows HIPAA is just the Privacy Act that people can't get your information.
Thank you.
Insurance companies will use this against you, right? If they find out that you have life insurance, if you have a lot of variations in your BRCAs and could put a woman at risk for breast cancer or a man at risk for breast cancer, mm-hmm. They can get a hold of that, and all of a sudden your premiums for life insurance and health insurance are skyrocketed.
Interesting.
So they are shameless in doing this. So having said that, probably the biggest one is long-term care. Trying to get long-term care, if your genome's out there and they've got it, you're going to have a hard time getting it, or it's going to be very expensive. Mm. So in my office, I don't need a name. And this should be true in any office. Mm-hmm. I have parents who, everybody's a John Doe, but it's a different one. So we can really know who it is. But that's, in my secret little book, that's not anything that anybody can pull up.
It's a wink, wink. Right. That's none of your business, Dr. Landis says. So you're saying we do. So can you talk to our community, Dr. Landis? I could go to your office and say, hey, I hear you doing this awesome stuff. Can you help me, please? I'd like my genetics done. What happens next?
Yeah, well, the genetics that I run two programs. One is for overall, we're looking at 20,000 genes. So, okay. I mean, it's a huge report. Mm-hmm. And that's going to give us, especially for people who have mystery illnesses or chronic illnesses, what it does is it says, this could be. So then we have to run laboratory tests to see, is it? Mm-hmm. Right? Again, just because it's a SNP doesn't mean, or a single a nuclear polymorphism, which we call SNPs. Just because you have a mutation doesn't mean the light switch is turned on.
But for people who are facing mystery illness or are seeing familial connections, and like my dad had this, my mom, or my brother has this, my cousins have this, and we get a chance to peek behind the curtain a little bit and at least have a maybe or a possibility, when before it was, we have no idea.
No, that's correct. So
Yeah.
it gives us then, target laboratory tests that we can ask a doctor to run, or, that we can look at to see, is this confirmed? And then
Right.
we can target treatment that. And then you get more into what's called precision medicine.
I love it, Dr. Landis. I think it's so important. It's a big thing culturally and socially right now that we're individuals. Do you know, right now we're all different. We all need different things. But I think, especially in medicine, not only looking at root causes, but also tailoring things for the individual, because I could take this specific B complex and for two people over from me, it would make them ill because of a possible MTHFR gene mutation, and depends on their expression. And I mean, there's just so many different things, but I love the idea that I can know what works for me. There's so much food shaming, supplement shaming, exercise shame. There's so many different, you should be doing this. Well, how come you're not doing that? Well, that's not going to work. But for this, it gives people a chance to know what works or might work for them. And I think that that's huge. So 20,000 genes, that's a massive report. Do people get a little overwhelmed? How do you manage all that information on behalf of the people that you're helping?
Well, we're not going to give them, the answer. We're going to give them, it would take forever to go through that with everybody. So when we run a program like that, we have known felons, which are in the thousands, and we look at the known felons, and then we line them up in a pyramid, and we start working at the base of the pyramid, working to the top, going through where we see variations. We then combine that with symptoms, and the computer will actually help us to start looking at specific areas.
So yeah, there's a decent amount of extra training for all of this. You have to be certified through certain groups to use certain systems. Like, you can't just run around like, hey, I can do this. No, you can't, honey.
No, this is
specialized.
Specialized. When I did my training in that, I think I was only the 70th doctor in the United States.
But how many dentists?
No, I'm always the only dentist, but there's more now, right? Exactly. Interestingly enough, there's more.
You're a groundbreaker. Hey, people, talk about growing. This man is pioneering the path for us. Yay. Yes. So Dr. Landis, can I ask you something personal outside of your field of expertise? Just as a person, you're pioneering, you're pressing into areas that just for your own personal growth and development, what's it like stepping into a field where there's nobody around but you that's doing what you're doing? Is that difficult? Is it lonely? Is it exciting?
Yes.
Yes. Yeah. Yeah. I hear. Yeah.
All the above.
Yeah.
It's interesting. I think that a lot of us set limits on ourselves. I'm trying to keep everything I'm doing to fall under the umbrella of scope of dentistry.
Yes.
Because when we look at these genes and I find a problem, I'm not going to prescribe a medication. I'm going to do a dietary change and a supplement.
Okay. And
so certainly within all dentistry, diet is, that's
within your scope.
Be terrific dietary counselors, right? Because it affects everything, not only the teeth, but the supportive structures.
Grains and sugar.
Yeah.
That's an opinion and is not meant to be as a medical diagnosis. Please consult your physicians.
Well, the interesting thing about sugar is it doesn't cause cavities, right?
Yeah.
That's really weird.
Yeah.
It's the bacteria that's in your mouth that eats the sugar that produces an acid.
Yes.
So sugar itself, if you don't have any bacteria in your mouth, it will not cause cavities. But you do have bacteria in your mouth by the trillions, and they love it. And
I love that stuff. And
so,
it spikes
yeah.
your histamine. Okay. We need a whole nother episode for histamine. Don't worry. I will beg him to come back. You guys hang in there. Histamine. Okay. Part 2, Dr. Landis. We'll do that later. Dr. Landis.
But having said that,
yeah, go ahead.
Almost
please.
For all health, the first thing we do is cut out sugar. Right. So, I mean, that's sugar and white flour are probably two of the biggies that we can make people feel a lot better if they would just lay off those.
Right. And it's hard. And there's layer upon layer of reasons why. And I have to tell you, family, I broke up with food a long time ago because of some of the particular needs I have dietarily. But you're pioneering, you're breaking ground in this area. I'm so grateful for this. And I know that the information that we're conveying is like mind-blowing and interesting all at the same time. But if there's somebody that's like, there's so much information, Dr. Landis, I am so overwhelmed. Can you just tell me a couple of things that I can start now, or places to go, or things to consider? What can I do now to kind of cut through all of this extra stuff?
Sure. So the thing that I'd like to explain to patients whenever I get started with them is wellness or health really is a three-legged stool.
Okay.
And that three-legged stool is physical, mental, and spiritual. So we can probably do in a lot of cases as much to benefit good health by addressing spiritual and our mental. And a lot of times the physical then will straighten itself out.
Interesting.
So we keep going towards physical medications, we're going to do this, we're going to change, we're going to do this supplement. But if you don't have those three legs equally reinforced, the stool will always fall over. So the first thing I like to do with my patients is to address and ask them, what are you doing for your mental health? What are you doing for your spiritual health? Now, spirituality can be many different forms for many different people.
Yeah.
Some people immediately think that is religion, and spirituality can be outside of religion. For me, it is God and my Savior Jesus Christ, and that is my basis for my spirituality, and I understand that's the direction for my entire life.
Right. But you're not personally trying to box somebody into what you're saying. Yeah.
No. Nope.
Yeah, I hear you.
No, that's a mistake. I'm not going to get health by doing that. I'm not going to try to make somebody me. So I want them to identify what's their love of life. Why do they live? What is their spirituality, and how are they nurturing that? Right. And it's like, we tend to neglect it. Well, there goes a leg of the stool. Two-legged stool will not stand.
Yeah.
What are you doing for your mental health? Do you even think about it? I mean, right now, under everything.
I'm seeing a therapist every other week, Dr. Landis. That's what I'm doing.
Well, so many people,
yeah,
so many people do so well with that, and they need to do that. But how many people look at that,
with a stigma?
I'm not going to do that. Yeah.
Yeah.
And it's, again, if you do not address that, you cannot have health.
It might be taking your socks off, putting your feet in the sand, and hanging out next to the beach and the waves with those negative ions, just giving you a sense of well-being. That can be something, you know what I mean? If you're not like, I'm not doing a counselor, that's not happening. There's 1,000 other things that we can do to provide a sense of wellness. How about just increase your water intake?
Well, that's, of course, a huge thing to do.
Yeah.
And there are studies that not only does it matter that you're increasing your water, but what type of water you're taking. So fascinating information on alkaline water. You can now, through several supplement companies, get things that add more hydrogen to your water. And of course, that's great because it has to do with taking care of all those free radicals.
Yeah.
And there's increasing information that some waters that come off of glaciers, especially near volcanoes, that have a little more silicone in them, are very beneficial because that is the one thing that will scavenge aluminum out of your body.
Wow.
It is the only thing that will scavenge aluminum. And they're finding aluminum in, and we could get really controversial here, but there's a big connection with Alzheimer's, autism, Parkinson's, and multiple sclerosis.
For aluminum. And family chlorine, which is also in a lot of people's water, or just, the pool, the hot tub, et cetera, things like this. It's just something to contemplate. When you combine aluminum and chlorine, it exponentially increases the toxicity in your system by the thousands, if I'm remembering my studies correctly. So definitely want to pay attention to the water that we're drinking. Plus, it just helps your filters, your liver, your kidneys, your spleen, just everything. It'll help elimination, and you want to make sure you're getting stuff out of your system that wants to come out. I mean, Dr. Landis, I feel like you and I could probably talk about this forever. And if you are a fly on a wall during my dental visits, you know that we do.
Always enjoyable.
It is. I really appreciate you. Dr. Landis, so if there's two things I want to ask you that I ask each of my guests before we close out our time together. What is your favorite season? And if you could pick winter, spring, summer, or fall in reference to your growth, overall or in an individual area, which would you pick? Are you in full bloom? Are you feeling like some things needed to die off and you're coming out of winter? Where would you say? So first is, what's your favorite season?
That's really an excellent question. And I knew you were going to ask it, and I thought about it for quite somewhat. And, I like all four of them.
No, it's hard.
It's hard because there's so much beauty in each one. I mean, there's the renewal of spring. There's the, what feels better, like you say, than that warmth of the sun in the wintertime. And yet, the silence of a fresh snow.
There's nothing. See, to me, the blanket of white and everything goes calm and quiet. It's just, nothing's better.
Colors of fall. Yeah, it's really tough. If I had to pick one, I would probably pick fall.
All right.
I just like that, sometimes that crisp nights, still warm days, but crisp nights and the color.
I think you might be our first autumn favorite so far. Yeah. So that's awesome. We appreciate that. And so if you were thinking about your growth, personal business, I mean, you could even pick one or two if you wanted to talk to us about it, but where do you see yourself in your growth season?
Well, interesting, having practiced for 40 years, of course, I'm in the beginning, the winter of my life. But in my personal growth,
winter's good though.
Yeah, in my personal growth, I would say I'm in the spring.
All right.
I am. There's another fellow in my group. We in Integrative Medicine at Arizona, who's almost my age. And then there's the rest of 70. And what's cool about this group, and Arizona does such a good job with it, they're from every continent except for Antarctica. So we're able to share so many experiences and cultures and thoughts, which has really been fantastic. But having said that, I'm twice the age of everybody in there.
Oh, wow.
Right? And so not only am I the only dentist, I'm the old man. But
good.
Yeah.
Good.
And
yes, there's an experience that comes with that would be missing,
The experience is helpful for sure. Looking at things a little different, from that lens of experience definitely changes things. Um, it also has given me the sense of so many things are missing in our healthcare system right now. It's become so automated. And so I go back to the old days where your doctor's appointments were, 30 minutes long, and they weren't 4 minutes, and you talked and your doctor knew you and he knew your name and he knew the family. And instead they're just a white coat blur in the door. Yeah. Oh, look at a paper, out the door. And it's not their fault. Right. It's these doctors aren't to be blamed.
Yeah. We're not anti-doctors over here. We're just saying that the system is it's like pumping people through,
You can't pay the rent if you don't do it any other way. So there are some of us that are changing that. You can go outside your insurance company and you can go to an integrative doctor. Or, I know you like these more specific things. You would be looking for a functional medicine doctor that relies more on specific tests. And they do more of what's called precision individualized. So again, for me, I'm not going to individualize a medication for somebody. I'm going to alter their diet and supplements and introduce exercise and things to help with the mind, such as Tai Chi. I mean, it's really great. Yoga is terrific. These are the modalities where we can increase spirit and physical at the same time.
Okay.
So getting into some of those, just exercising, go for a walk.
Yeah.
Right? I've got people who it's like, do you ever get up? Do you go outside, take a break? Do you walk for 5 minutes? I mean, we're looking, for 150 minutes a week out of somebody. That's really what we're striving for.
Yeah.
But do you even do 5 minutes? Right? Do you go out and do you do any breathing exercises? We can control anxiety with very quickly with breathing exercises.
Interesting.
It's amazing. You can go from panic attack to totally calm with some simple exercises, and you can find those online, and they work.
Yeah. I really appreciate the diet and supplement for me because I find that, and it's hard for people to understand this, but cutting certain foods out has had an incredible impact on my mental health. And people don't understand how something that I put in my stomach can affect my brain. And I tell them, think about ibuprofen. It goes into your stomach and gets rid of your headache. It's the same idea, but especially because of my drug history, I think there's some permeability in some areas where there shouldn't be. And stuff that will give someone else digestive upset gives me a panic attack. And so really, I think what we're coming to as far as this entire conversation is mindfulness of your body. Pay attention to what your body is telling you, the signs in your mouth, the aches and pains. Think about what you ate the day before. Don't be afraid to face the things that we might need to change, because the outcome is exponentially better with even small changes. Taking a walk every day, drinking more water, going to see an awesome dentist. So Dr. Landis, thank you so much for your time. I will, of course, include this in the show notes, but I was wondering if somebody is in the greater DC, Maryland, Virginia area, and they need a dentist, how do they get a hold of you? And if someone would like some genetic counseling, which I can't wait to do this with you personally. I think it's the next step in helping to take a hold of our health and be responsible for ourselves a little bit more. How can they do that with you as well?
Sure, they can find me. I do not have a website.
No, that's all right. Email.
Yeah. So, they can email me at Harold E. Landis, DDS.
You're good. Go ahead.
Verizon. Yeah.
Okay. Also, I know that folks can use the internet and just look up Harold Landis DDS, Silver Spring, Maryland, and there you are. You pop up every time. And then the office staff, there's amazing guys. They'll point you in the right direction. So it's really not overly complicated, family. You can find him. He's amazing. And I hope that you've had an informative and encouraging time during this time together, growth season, family. Dr. Landis, thank you so much.
Thank you for having me. It's always good to see you.
You too. I hope that you'll come back and see us again, sir.
Thank you so much. And you have a great evening.
All right, you too.
Okay.